set out to provide great quality of care.
3 of us were residents together at University of Michigan. We came to Grand Rapids for various reasons.
And those doctors were Drs. Rosenberg, Gerbens, and Vanderveen. Within a month or two, Dr. Van Wessep joined them. And almost immediately, a significant portion of the eye care in West Michigan was being delivered by Grand Rapids Ophthalmology just on the basis of the numbers of doctors that were part of the practice.
It started with everybody kind of taking care of each other from the beginning. The partners worked together, always have worked together.
And we decided that we wanted more than just what Grand Rapids had to offer. By combining our efforts.
Because of our size, we're able to have the equipment that many smaller groups cannot have.
I felt that this was a great community, and I felt there was a tremendous possibility for growth, particularly in this practice.
Certainly we're the largest group in Western Michigan, and actually unique in some ways throughout the country. Grand Rapids Ophthalmology offers a unique ophthalmologic and optometric practice, not only in Western Michigan, but it's undoubtedly one of the largest in the country and most comprehensive.
Grand Rapids Ophthalmology has always wanted to be a viable part of the community in addition to providing eye care. Grand Rapids Ophthalmology is unique in the sense that it provides this really high quality but very broad spectrum of care in the community.
You get a chance to talk with some of the best people in the field. And that's just a very unique thing that we have. And we have a team of opticians here. We have a staff that is dedicated to helping every patient that comes to the door. And just the size of our group allows us to really help someone from start to finish with their eye care.
The surgeons and the doctors here are all advanced, well-trained in their specialties and in general ophthalmology. With regard to patient care, we have multiple locations around the city in Western Michigan. So we don't always ask you to travel real far to see us. We often will be able to go to you. You have all ranges of services, including surgery, including simple glasses, including basic eye health. Here at Grand Rapids Ophthalmology, there's really no reason to go elsewhere because we offer all the services.
We cover all phases of ophthalmology, from young children, babies, through our pediatric specialist, Dr. Peepo, all the way through a number of general ophthalmologists like myself who do LASIK surgery, cataract surgery, glaucoma care, etc. We also have retina care and a number of optometrists who do just routine eye exams for glasses.
Well, I've been in pediatric ophthalmology since 2002 here at Grand Rapids Ophthalmology. The practice itself is really quite versatile. I work with a population starting with newborn infants all the way up to 18 years old.
Everything from contact lenses to eyeglasses to operating rooms to clinics.
Great technology, the most modern equipment that you can have, but also the personnel. And the personnel is really key to having, I think, a world-class facility. And that starts from all of our physicians, from our ophthalmologists, through our optometrists, through all of our staff and our technicians.
Just restoring their hope, their ability to live their lives. That's what we do.
We have over 900 frames in our optical department. I'm able to fit people with every lens available, starting with a luxury line to a more boutique to the more conservative.
I'm also fitting contact lenses, and we have every contact available: soft, hard, gas permeable.
We are very competitively priced. We have certified opticians that can help you with your selection.
Having an internal lab allows us to keep the products competitively priced. Quality is our biggest goal when we're creating lenses. The ability to do everything in-house cuts down on the wait time.
Well-trained staff. They're not just salespeople. They're trained in health care.
It's the total package. I mean, it's not one thing that's stressed. It's eye care that's stressed instead of product that's stressed, and that's what's unique about Grand Rapids Ophthalmology.
One of the benefits of Grand Rapids Ophthalmology is that we specialize in virtually every subspecialty of ophthalmology.
I think we have accomplished the goal of providing very comprehensive, complete care to our patient population.
The key is for every patient to evaluate them properly.
We literally will take care of almost all eye needs all the way through a person's lifetime.
Our group prides itself in having almost every subspecialty in ophthalmology. Add to that the fact that we have our own surgical center, which is a huge advantage.
From the time someone comes into our surgical area to have the surgery, we have staff who are specifically there just to handle people who are having this type of surgery.
Most patients decide to think about laser vision correction after years of contact lens wear, and the contact lenses have become more uncomfortable for them.
I'm very, very proud of the fact that we do really state-of-the-art work. We have the #1 laser in the world. We're actually the first group in Western Michigan to have the intralaser. If you can imagine a millimeter is 1,000 microns, okay? The cornea is half a millimeter thick, or 500 microns roughly. And to correct most people's vision, we're removing like anywhere between 15 and 75 microns of tissue. So picture a millimeter and picture 15 to 75 thousandths of a millimeter. That's what these lasers are doing, and they do it extremely accurately.
Skin Solutions is located right in the Walker office. We have a gorgeous, welcoming, spa-like atmosphere. Skin Solutions is a full-service skincare facility.
I often get asked why we have a Skin Solutions department at Grand Rapids Ophthalmology, and it's pretty interesting. It actually is a nice, natural fit.
We're fortunate to have our skincare department because Dr. Boyle and I refer patients back and forth to them. If they find someone who needs eyelid surgery, we can take care of that, and then we refer the patient to them for various cosmetic procedures that they perform.
Cosmetically, we work with upper and lower eyelid blepharoplasty, cosmetic brow lifts, lasers, and facial fillers.
Many of our patients come to us first as medical eye patients.
Everything from just general skincare needs to acne issues to Botox and filler.
They have set the bar in regards to not just the types of procedures that they're offering in this community, but also the level of expertise that they have.
They treated me very well.
I was able to see things already that I couldn't see prior to the surgery.
The impact on my life can't even be measured.
I've been very pleased with the results.
They were really concerned about my health and about my wellness, and that I was getting the care that I really deserved. So I didn't really feel like a customer. I felt more like family.
We were never afraid to innovate and try different things. Always the focus being on the patient and delivering the best care we possibly could.
We're not just one-time doctors. We tend to follow you through the lifetime of your eyes.
Just on a day-to-day basis, we expect to restore people's vision.
I love our profession because of the constant research that's going on.
I really have felt lucky to be able to have the opportunity to care for the patients that I have.
It's part of the goal of Grand Rapids Ophthalmology to be there for Grand Rapids.
And we're just doing our job, and we like to do it well, but for the patient, it is a life-changing experience.
I want people to walk away feeling that they've had a great exam, a great interaction, and they've had all their questions answered.
You can have such a dramatic impact on people's quality of life, and there's few things as rewarding as that.
We want to really give our patients the best care that they can get.
It's been an exciting time in the history of ophthalmology, and it's been fun to be part of the progress and the change that's taken place over the last 30 years.